All right, well, hi all. My name is Jonathan Tunwar, and I serve as the Associate Director for Family Programs. My pronouns are he, him, his. And when I say I serve for I work with family programs, that means my job is to plan family weekends as well as to plan family orientation, and then I do family communications. And so that's a little bit about me. I'm going to ask the rest of our panelists to introduce themselves so that we can get to know them a little bit better.
All right, I'll go. I didn't know if we're just jumping in. My name's John Fritch. I have worked at Virginia Tech since 1987 or so quite a while. I'm in Hokie Wellness, so I do a lot of teaching, education, programming. I do tobacco treatment for the health center and multiple other things related to preventing and helping students be healthy and happy. So it's a little bit about me.
Good morning, everyone. My name is Kelly Mcpherson. I'm the events coordinator for Rec Sports. I also serve on the family weekend and the orientation committees to help new students and families learn about all of the programming that Rec Sports has to offer. And this morning I brought with me Sarah Carter. She is one of our supervisors in intramurals, and she's here because she is our expert to answer your questions on intramurals that I might not be able to fill in.
I don't know if I'm an expert, Kelly, but hi guys. Oh, I'm sorry. Good morning. My name is Sarah Carter, as Kelly said. I'm a junior. I'm studying international relations and religion and culture. I've been working with Rec Sports for 3 years now. I was an official for the first year, and I've been a supervisor for this last year and this year currently. And if you have any questions about intramural sports, I can be happy to answer those.
My name is Jess Westcott. I work at Cook Counseling. My official title is resident in psychology, which basically just means that I am under supervision to become a psychologist, but haven't quite reached that milestone yet. I've been at Tech for a little over a year. My wife is actually a PhD student here at Tech, and so I get to see both sides of what it's like being a staff member and see what students are going through, particularly graduate students. Use they, them pronouns, and yeah.
I'm Ashley Woodward, and I'm a junior in mining engineering. I work for Hokie Wellness on the impact team, where I'm a peer educator, and we focus on alcohol prevention and education.
And I'm Adrienne Diggs. I am a graduate student studying for my master's in public health. And I work in the peer education part of Hokie Wellness for both the health education awareness team with John, where we talk about nutrition and sleep and safe sex, and also the mental health division, where we talk about resiliency building and skills to help build resiliency.
Jonathan, you're muted.
Did we make it through everyone? Awesome. Okay. Well, so families who have joined us, what we'll have you do is we'll have you submit your questions in the chat. We have some pre-submitted questions that I'll go through, and then we'll get to the questions that you submit in the chat. So make sure you drop those in there. But the first question for our panelists is, what is your department doing differently to meet the needs of students during the pandemic? And whoever wants to go first, just jump in.
I'll jump in real quickly. So our biggest facility is McComas Hall, which is our rec facility and gym. So we did a lot of work this summer to take a lot of equipment offline. We took all of our basketball courts offline so we could move some of the equipment. They're all 10 feet apart so that we can, once they get to their equipment, they can take their mask off and exercise free of their mask. And we're following those CDC guidelines. Lots of cleaning in between. In fact, we are closing McComas from 2 to 3 every afternoon for a deep cleaning before the next session begins. So we've been following VHSL rules and CDC guidelines for sports, and making sure that we started out not sharing equipment. Sarah can probably fill in a little more about intramurals, but we're starting to add some sports where they share equipment, but adding cleaning protocols. And we have opened a new facility, a Rec Sports Field House, with an extra weight room and more courts for sport clubs and some rec time to spread out. So we have more room since we did have to limit numbers in our main facility.
Yeah, so going off of that, before you participate in any intramural activity, you have to have your temperature checked. It's actually hands-free. It's like an iPad setup, and you go and you get your temperature checked. If you have anything that's above normal, you're not allowed in. All VT intramural staff has to complete the Hokie Ready app, which shows that we have not been in contact with anybody that has had COVID, and that allows us to come to our shifts. We sanitize all equipment in between every single field of play. So every hour we sanitize equipment, and we ensure that both staff and participants wear masks during the entire hour of play.
I can go. We're probably going to cover a lot of today, so I won't be crazy specific yet, but obviously we do a lot of workshops and educational programs, and we've pretty much adopted COVID guidelines like many of the public health entities have, and everyone across Virginia Tech. We're offering about 95% of our content. We're just doing it virtually. We do miss being in person, but it was very challenging to have very many in-person locations that you could have enough students to make it worth having the location. So for example, a room that could normally hold, I'm just throwing the number out here, 40, 45 people was down to about 9 people in the workshop. So, and there was a bunch of challenges with that. So we've moved to virtually. So all our workshops are online now, at least for my part of the department, and many other the Hokie Wellness. So I think the thing that has been impacted a little bit is our ability to do walk-up outreach. That's where you set up things and you just sort of do walk-by education, or you encourage students to come together. This is the time when we're trying to not encourage more random encounters very close. So we're still working on that, and we hope to be able to, I think we're going to have something out by the end of October that is sort of a walk-up outreach based thing. So we're excited about that, but I think we've adjusted pretty well, and I think the students are actually enjoying some of the virtual programming that we're doing. So that's good.
Yeah, and to kind of touch on that as well, because I am also working with Hokie Wellness, we have transitioned most of our courses for the alcohol classes to be online format over Zoom. And so far, it's actually been really great and interactive, which was something we were worried about to begin with. But being able to still provide those resources and still be able to talk to the young pledges and the fraternities and other organizations on campus about alcohol culture, it actually has been really good so far in our Zoom transition.
I can follow up with Cook, but Adrienne, I know you're with Hokie Wellness as well. Do you want to pop in?
Yeah, sorry, I didn't realize I was muted. So as far as the education we do in HEAT, like John covered, and FEELS, our mental health sector, they are all virtual, which for mental health I've found has actually been really helpful. We have a lot of referrals and maybe some people that feel a little bit more reserved or shy about what they're going through, and they feel like they can actually reply to me in the chat, whereas they wouldn't normally speak up or engage in a regular workshop setting. And it's given me a better opportunity to click with people after the fact when I send them their Friday email with resources. Some people have replied to me and asked better questions. And overall, I feel like engagement could go either way. People could be less engaged or more engaged, but it seems like mental health workshops, people seem to be more engaged because it's given people some more anonymity if they feel like having their camera off, and it's given people a better opportunity to connect one-on-one with someone in a virtual offering where they might otherwise not in person.
Similarly to what Hokie Wellness is doing, we at Cook Counseling are primarily telehealth. So we do have some options for students that are in immediate and imminent crisis that they can still come in person, and still allowing that option because we know that sometimes people need that human interaction, especially when they are at risk to themselves or others. But most other services we're doing virtually. Some of our psychiatry services, we are having students come in just to check vitals. So especially for something like treatment with ADHD or other mental health concerns where like weight might be a concern, we are still having students come in just so the nurses and the psychiatrists can get eyes on them. But most counseling sessions are virtual. We were actually in the process of adjusting some of our model prior to COVID, and then the pandemic hit. And so there were a lot of changes that were already in the mix. Some of the big ones were we were in the process of implementing a triage system, which is currently what happens. And we found that it has been really effective in getting students in sooner. So one of the biggest areas of growth for Cook over the years is that once we get into October, sometimes it can take 2 to 3 weeks to get students in for an intake, so an initial appointment. Right now, we're at the beginning of October and we're getting students in within 4 to 5 days for an initial appointment, and then within a week for an intake, which I think has been particularly helpful for COVID, because with the amount of like isolation and maybe increased distress that some students are feeling, it's been really helpful to get them in sooner. And we've seen a significant drop in crisis appointments as a result. Some of the other changes that we've made in response specifically to the pandemic, we have a COVID positive support group that one of our staff members and one of our nurses is running. We have an anxiety group that meets every other week that is more focused on COVID specific related anxiety. Those are the two big things that are coming to my head, but I think overall, we've been able to adjust pretty well. There are still, similarly to John, there's something about being in person with students that we're definitely craving and missing, but also similarly to what Adrian was saying, some students have been able to reach out for counseling services that might not have otherwise, because they can either keep their video off or talk on the phone. We've found the same with groups too, that we've had a bit more buy-in because we can tell students, if you just want to engage in the chat, that's okay.
All right, well, that was really helpful, I think, to our families. The next question is, how is Virginia Tech prioritizing mental health for our students right now in this pandemic? So I think to help us give some structure, I'm gonna say, let's start with Cook Counseling, and then let's go to Hokie Wellness, and then go to Rec Sports if you all wanna add anything.
Yeah, it's funny because I think just the nature of Cook Counseling, that's what we do day in and day out, is prioritizing mental health. But I think some ways that we've been doing that a little bit differently, especially in response to COVID, is really emphasizing our workshop and group resources. And this might touch on another question that you might ask later, Jonathan, too. But one of the biggest things that we're seeing when students are coming in is, there is kind of that like expected anxiety and depression, but we're hearing so many more concerns about social isolation, loneliness. That was already a concern, but I think it has just been increasingly heightened as a result of the pandemic. And so for us, having options that facilitate some more interaction with people outside of just the student and the individual counselor, right? Because what's probably going to be more helpful to that student that's dealing with anxiety, but also loneliness, is getting them in a group where they can be around other students, make other connections, and also work on whatever mental health concern they're coming in with. We have also expanded our workshop options and our online materials. And so on our website, we now have a number of recorded workshops that students can access at any time. We've got a recurring 2-part workshop every week that's Wake Up and Wind Down with Cook to help support students, particularly that are struggling with motivation. I think we've increased our engagement on social media by quite a bit, especially on Instagram, still using the therapy dogs as a way to get students in. So yeah, I think that can be a difficult question to answer since I feel like we're already doing that. But hopefully some of the ways that we've adjusted are just prioritizing it even more.
All right, let's hear from Hokie Wellness.
Adrian, do you want to go? I think that a lot like what Jess said, we mental health always was a priority for us even before COVID, but I'll go ahead and let Adrian talk, so I want to give her a chance.
Yeah, so previously as Feels, we offered a workshop called Key to Connection, and that was mainly for people that may be transitioning from high school to college or maybe transfer students. But right now it feels like a lot of people are seeking that connection. And we're in the works of redeveloping Key to Connection, because previously it was a lot about, use common spaces, leave your door open. And right now that's not what connection looks like. So we've reformulated the workshop, and we're in the works right now into changing exactly what support systems are going to look like in COVID times. So we're in the works with that. And hopefully that will probably be one of our bigger workshops. Right now, we're working a lot with self-care resources that people can utilize during COVID. So that's been pretty fun. But I think connection is going to be the biggest thing, because like Jess was saying, people are feeling lonely, they're isolated, and we've got to get creative with how to connect them with support systems and how to provide them with that connection in a safe way. So that's what our main focus is right now.
Jonathan, I'll just add very briefly from Rec Sports. I know front facing, it looks like a department that's very much about physical well-being, but we do have a lot of programming and focus on mental health. And a lot of people probably don't know, we just have a really good relationship within the whole well-being departments put together, where if a student goes to Cook Counseling and maybe needs, instead of medicine, is prescribed exercise, and then they will come to Rec Sports and have a consultation with us and work on a plan through our wellness side of our Rec Sports as well. So we know that exercise clears our head and releases chemicals in our body that are healthy and are good for our mental health. And so we do express the Hokie movement and encourage students to move, not just for their physical well-being, but for their mental health as well. And I think that our departments are really good at working together to know who the students are who may need it more than others, so that they bring them to our department so we can find out the best movement for them.
Kelly, I really love that, because this month our Hokie Family e-news is actually about mental health and wellness. And one of the things that I was going through, I was like, we also still need to talk about physical wellness, because that is such a big part of our mental health. And so I made sure that we added that piece, and this is why we work great together.
That's awesome.
The next question I want to ask is, what are resources that your department offers that families may not be aware of and are often underutilized? So let's go in reverse order. So let's start with Rec Sports, go to Hokie Wellness, and then go back to Cook Counseling.
Okay. I'm just going to talk about facilities, really, not necessarily programming. For those of you that don't know, our main programming, though, is intramural sports. We have aquatics. We have sport clubs, which are sort of between NCAA athletics and intramurals, so they compete against other schools. And we have Venture Out, which is an outdoor program. And we have fitness, which we have group fitness, personal training. All of those are available. I think in COVID times, where students feel like they don't have a lot to do, I want the families to know that we have a lot of outdoor options, which is, people are saying, safer to be outdoors. And more spread out. So for those of you who don't know, we have a 9-hole golf course on campus. It is beautiful. We have great student rates that is overseen by recreational sports. We have 12 tennis courts outside on Washington Street. And if you go just across the street down into the Prairie Quad, we have an amazing outdoor fitness park It looks like a giant adult jungle gym with lots of suggestions there of things to do. You can bring your own weights or resistance equipment, or you can just swing on the rings. There's all kinds of strength and conditioning things that you can do that are outdoors. We also have a huge turf field right by our new rec sports field house, where you can go kick the ball around, throw a frisbee. There's a path around it and actually hooks up right to the Huckleberry Trail, where you could do some outdoor exercise, walking, running. So get outdoors. And if you're not sure where these places are located, get on our website and we can help you out.
Do you want me to go? Do you want me to go next? I know it wasn't the perfect result. Obviously, just to refresh, I'm in Hokie Wellness, and it's not just during COVID times, it's all the time that we wish more people knew about our programming. So that's always a battle for us, and particularly because we have so many new students coming in and new parents added into the mix that we want to tell them what we do all the time. And it seems like, gosh, I know we've done so much advertising about this. How do people not know about these services? And I know across the university, that's a common theme, I think. But some of the things that we offer so many different types of programs. Just within the last year and a half, we added a financial wellness person that does budgeting and credit scores and how to get a loan and how to deal with student loans. That's in our office. He does individual appointments and online workshops, and we're really excited about that. We have for years, and it was one of the establishing department here, has done alcohol and substance abuse workshops. They have a 21st birthday program, which students can go to try to, and where we try to reduce the negative outcomes from the night of the 21st birthday or around 21st birthday celebrations. We have professional staff members whose sole job it is to meet with students that have gotten in some sort of trouble. You just use that word for alcohol consumption often, and talk to them going forward about how to keep them out of that trouble going forward in the future. So we have 3 or 4, I think we have 2.5, 3 professional staff members that just do that. In the last 2 years, we added a full-time mental health programming specialist. Adrian, that would be Adrian's boss on the things that she does. So they did a ton of new programming there, and we are super stoked about that. I happen to work with my wife, who's also in my office, and we have for 20 years, and she runs an amazing project, which also Adrian's part of, called the Body Project, which helps women deal with society and the negative images and everything that they get bombarded with about their bodies, and how to develop a positive body image. One of the most exciting things that I've experienced. I really enjoy that program, even though it's for women only. I think it's amazing. And each one of the Hokie Wellness's departments offer prevention workshops. My personal one does sexuality related. We do sleep, nutrition. This semester, we updated our whole Unwind Offline program, which is awesome. I really like that program because it talks about device use and healthy device use and what our devices are doing to our brains and how they're changing our relationships and they're changing our sleep and our mental health. And that's not specifically a mental health program focus, but it's all about mental health, is getting control of your device. And I just added a vaping program, that vaping prevention and education program. The other thing that I directly do is I'm a tobacco treatment specialist. So I see students, if they want to quit smoking, dipping, or vaping, they can make an appointment that is paid for through their health fee. So they don't even pay anything for it. And I'll meet with them, or one of the other tobacco treatment specialists will meet with them for however long they want, which is a service that many universities don't have. We have highly trained and highly qualified tobacco treatment people, and I've been doing all those appointments virtually. And while I certainly love seeing a student or anyone in person, it's a lot. It's been very helpful, I think. In fact, I get better attendance online because they can just fire it up, or I can send them a note and say, "Hey, you're late." They don't have to drive to the university. They can just get on. So I might have taken a little bit more of my time, but that covers a lot of the different areas that we do and we want parents to know about.
I might get a little bit on a little soapbox here, but I would say which this is what I was referring to and saying that I might answer this question a little bit later as well too, but really our groups. So I think so many students come to Cook or come to counseling, and it's that, you know, the go-to image of like the individual in an office with a single counselor, and you're doing like weekly individual counseling. And while we do offer those services, we have plenty of those services. I think really where a huge strength of ours is with our groups. And so often we have students come in that are really hesitant to engage. You know, it can be an anxiety-provoking situation to be in a group with people who you don't know. We do have some groups, we call them interpersonal process groups or USO groups, which is our understanding self and others groups, which are really built on the foundation of having interpersonal relationships and working through what different relational dynamics look like and emerge from the group. And so there is an expectation that there's going to be engagement and talking. And that can be, I think, frightening for a lot of our students, but so often when we get back our survey results at the end of the semester that look at client and student satisfaction, every semester that we've had, students report that group was either as helpful or more helpful than individual counseling, in part because most of our groups are able to meet weekly, whereas for individual counseling, we're really more on like a bi-weekly or every 3-week meeting schedule because of the amount of students that we have. And so not only with group do students get more regular treatment, but they're getting that experience of getting to hear from their peers that they're not alone, that other people are going through the same thing that they are. They can share what works for them and what doesn't. And so I often tell parents, you know, if you're concerned about your child, if they're talking about going into counseling, we really want them to come in before it's at the threshold of it being really bad, because we can easily get them into a group, have them develop some coping skills, some healthy relationships with others, and oftentimes that is able to offset some more significant mental health concerns that might come up later. And I think we have like 15 or 16 different groups that are running right now. I run an ADHD skills group, there's many anxiety groups, a depression related group, interpersonal process groups, Facing Our Fears, which is a OCD group. We have a social skills group where the students just play D&D. It's like a Dungeons and Dragons social skills group. So, you know, they're a lot of fun. It's not just like you're just kind of sitting and getting lectured at. So yeah, that would be my little plug. Is we have great group services, and I think they're often underutilized. Right now, the therapy dogs are not available for in-person appointments. They are still very active on Instagram, and we do have a program that's running where Derek, one of the therapy dogs, you have to guess where Derek is on campus, and the winner of that contest gets a picture with Derek, but it's like outside and very quick. So no, unfortunately, right now we're not doing in-person meetings with the therapy dogs.
All right, so I'm going to take us to our next question. We're going to go in reverse order. Sorry, Dr. Westcott, that means you have to talk a little bit more.
Okay.
But it says there's been a lot of focus on COVID, and rightfully so, but are there other areas of health that students and families should also be focused on?
I think the loneliness piece is definitely up there, as it always is. I think especially for freshmen coming in, that adjustment period is already so difficult. Meeting new friends can be a challenge, along with the adjustment of high school workload, going into college workload. And and that right now, I think, is increasingly difficult for students, especially freshmen, because they have to stay in pods. And, if you don't necessarily get along with the people in your hall, that can be really isolating. So I think just looking out for that level of isolation. The other thing is, looking at Virginia Tech as a STEM-focused school, we have a lot of students in like engineering and agriculture. And one thing that I see a lot is some perfectionism, but I think what it really is this identity that's wrapped up in academics, that we have so many students coming in that really their anxiety or their depression or some of their relational concerns, when we get at the root of it, it is that they tie so much of their worth and their identity and who they are as a person to how they perform academically. I would say especially those in STEM, like my engineering students, that is just really at the core of it. And so if they aren't motivated one week or productive one week or have a bad test week, it is devastating. And so I think, again, just looking out for that in the students in your life, the kids in your life, even doing some reinforcing of your own that, you are not your grades. It's okay if we have bad weeks. Everyone's going to have ups and downs. But just having some other reinforcement outside of just what they're getting in counseling to say you are more than just your GPA, because so many of our students just believe that to their core. Yeah, I would say those would be the two big ones outside of COVID-related mental health issues.
Yeah, I think that's super important, especially when we think about the type of student that comes to Virginia Tech, right? They tend to be high achieving, and so they come with a different set of concerns when it comes to their mental health and different pressures that they put on themselves. So now we're going to go to Hokie Wellness for you to talk a little bit about what other concerns you think students might have.
Adrian, you want to jump in on that one, or I can jump in on it?
Sure.
Since you're a student, I think it'd be good to have a student perspective here rather than mine. How's that?
Yeah. All right. If I miss anything or you feel that there's something pertinent going on besides COVID, let me know.
Right. And then we could hear from Ashley too. That would be great.
Yeah. So aside from the pandemic, there's also, like Jess was saying, that pandemic of loneliness and isolation, and seeking connection right now is like a tricky tightrope walk of mindfulness in device use and trying to be cognizant that we need our devices to connect to family and loved ones and friends right now, to feel support and to feel like we're not isolated. But we also should be mindful of how much media we use and how much we're on our phones, because it's like a double-edged sword. On one hand, you feel connected to people, but then you can feel yourself being too absorbed in your phone, feeling that maybe this social media is having a negative impact on your mental health. So right now, I think just being more mindful and practicing mindfulness about how exactly being on your phone or being on your device makes you feel, I think that would be really important for students. And we do practice that or teach that workshop year round. That's not just a COVID thing, but we have adapted that, and maybe John could talk about that. But we have adapted our workshop just to be more cognizant of what exactly Zoom fatigue is, and maybe something that we all feel when maybe we schedule a Zoom meeting with our family and we want that connection, but for some reason we have this lingering feeling of, oh, I don't want to get on Zoom. Like, why is it that I'm hesitant to connect? And with all the device use we've got going on right now, I think that that's really important to name so that people feel like understand what they're feeling. So yeah, John, do you have anything to touch on?
No, I think that was excellent. Ashley, do you want to jump in on that?
Yeah, I can add a little bit. So I guess as like a current undergraduate student, like during all of this COVID stuff, I do want to talk about like alcohol use and during this time period, especially it's something that people should keep in mind, and also keep an eye on the people around you as well with any kind of like substances at the moment, because like we're talking about, it's isolation. Like there's not much to do right now at all. Like maybe there were activities beforehand that were more healthy that you'd like to do in groups, or maybe at other settings that just aren't really viable options at the moment. So maybe some of your friends who were struggling before, maybe it could be getting worse, or people who have never really like dealt with this feeling or this isolation before, maybe are leaning towards different substances to fill their time. So I would just say that is an issue. It's always an issue, but it's definitely heightened in this day and age. So I just check in on your friends, like check in as a parent on your kids, make sure they're doing okay. That would definitely be my recommendation for the time period.
And I do think I also, Blacksburg is beautiful right now. I mean, the leaves are starting to turn. It's stunning. We live right across from a big outdoor park in town, and the parking lot is overfilled with cars. There used to be, I mean, it's a mixed blessing. There used to have a 180-acre park to myself and a few other people. And now there's a lot of people using the park, which is of course great. And even when my kids are doing remote schooling, whenever they're on a break, I tell them, go outside. You have to get out of your room. You've got to get off in front of this computer. We can't be doing that. So I'm sending them outside to do stuff. So we're really encouraging people to adopt things. And I think the rec sports outdoor offerings are great. And there's just so many things before the weather gets that nasty cold and rainy stuff that it can occasionally do later in the season and in early winter. I think there's just encouraging your student to go outside or find something fun outside to do is very helpful mentally. Just doing that does make a big deal. That was before COVID, but it's even more now that COVID's here. So.
Well, the great thing about sports is it brings people together, right? And in this time where people may be hesitant or not know how to come together, rec sports is continuing to do that. So we just want people to know that we have 30 sport club teams. In the very beginning, we weren't letting new students join, but we have now lifted that and freshmen are allowed to come out for sport club teams. Each one is different, and we have ice hockey, lacrosse, club soccer, gymnastics. So, this is where people have a passion. They come together around a sport that they're already interested in and they find their people. And this year, even more so than ever, it's important for people to find their group. And so rec sports is still here. We are following guidelines, and it might look and feel a little bit different, but we still have 30 teams running. You can check out our website so your child can find the right one for them. And each team is going to have a little different method of how they're following guidelines and when they're meeting and how they're allowing sports to take place. They're not traveling and competing with other universities this year, but they are training. But some of our clubs have found ways to virtually compete. If you're running and you have a measured course and you can time and report those times, they can still have that competition with other teams. So finding your people, one of my favorite events that we haven't done yet this year because we weren't letting new people join yet, was we did a group run for Welcome Week last year. And as a mom of a cross-country runner, I saw all these high school runners come together who aren't running in college, but that's their thing. And they automatically met 75 other people who were just like them, who were freshmen that ran in high school and were trying to find those people to run with. And so that's open now. We have a great running club. So whatever sport the students are interested in, we're here for them. If they are not as competitive as wanting to try out and be on a super competitive team, we have intramurals, which is why we brought Sarah today, because she is going to tell us how they can more casually come together and what sports we are offering safely right now.
Yeah, so obviously we can't offer soccer or football or basketball like we normally would have during this semester, but we've definitely adapted our team sports to have that outlet for people to get that physical activity they need and still have that connection, even if it's at a distance level. So for team sports, we're offering volleyball, 4-on-4, which is smaller than we normally would have offered. We're also offering pickleball and badminton, which we haven't offered on the team level before, which is pretty cool. And due to the fact that cases are stabilizing and stuff like that, we've recently added an 8-on-8 kickball and a 10-on-10 softball league that you can join now, because it's more of a distance sport already. with the mask aspect and the cleaning aspect, we're still able to provide that sport outlet for people. We do still have singles competitions like disc golf and tennis and stuff like that. But our team sports, I know, are a big outlet for people just to let off some steam, whether it was you got a bad test back or you're upset at someone and you just want to see friends and connect on a physical level. So team sports are really, really, really important. And I'm happy that we added kickball and softball this semester for sure.
So my next question, we're going to go reverse order, wanting to know what are some ways that families can support their students and particularly encourage them to get involved with your office. So how do we think families can do that with their student? And I think it's great because the first person is actually a parent, and so they can talk to us about that.
Yeah, I think it's hard having a college student and being far away from them and not always getting all the information. I know a lot of times students say, you know, there's nothing to do and I don't leave my room. And from the employee side of it, my response when I hear parents say that is, we're doing a million things. There's tons of things to do. And so I feel like sometimes there's just kids don't know where to look, or they have communication is key, right? I think parents need to get on social media. The kids will probably disagree with me. Our social media campaign in rec sports is amazing and up to date and it's clever, and you will find out all of the things that we're doing. And I think that you'll learn a lot. Our website is completely up to date. So, you know, going in the back end and having parents look through our website, go to things like this, where they can hear all of the amazing opportunities that maybe students between being in class and being in a new environment are missing, so they can help sort of fill in the blanks for them. I know everyone's comfort level is different, so we're trying really hard to offer in-person and virtual opportunities. So you know your child best. So if you're trying to encourage them to go out there, but you know they're introverted and they like to go to group exercise classes, but they don't want to be inside a building with people right now, we totally get that. And so we have a virtual group exercise pass. You can also go inside McComas and take in-person classes. So we're trying to think about it from all angles. As a parent, I just think the best way to be informed is to be on our website and be on social media and know your child. And maybe when they come to you frustrated that they're not meeting people, get on Gobbler Connect, or encourage them to get on Gobbler Connect, because all of our events are going up there and there's so many every day that there's gonna be one that fits their comfort level and their interests. So just giving them the right platform to find information is important.
All right, Hokie Wellness, anything you all would add?
No, I think obviously we got a couple of the students that are working with Hokie Wellness, and I think everyone's done a great job there. So if I'll be happy to answer any questions if anybody, or chat them in, or let us know if you have any questions in addition to these.
All right, Dr. Westcott, anything you would add to that? How can our families encourage our students to get involved and find ways to connect?
I'm trying to think if it's VT Engage that does it, but this is not related to counseling, but there is a wonderful program called Involvement Advising that, I think it's VT Engage does.
It's either VT Engage or Student Engagement and Campus Life, one of the two.
Yeah, either one of those. If you just type in Virginia Tech Involvement Advising, they have student ambassadors that meet with students that are wanting to get more involved on campus, to talk about what particular interests does the student have, what have they been involved in the past, what have they liked in other organizations, and then give recommendations on what might be a good fit in terms of organizations or clubs on campus. They have, again, like most of us, adapted to fully virtual sessions. I've sent a number of students to that resource, and it has been very helpful to narrowing down what a good fit might be. I don't know if y'all have ever been on Gobbler Connect, but we have so many organizations that I think sometimes students can feel a little overwhelmed and not know where to start. And so that is a great resource. Even right now, and I also tell students, you don't have to be a freshman to feel like you're still finding your group or getting involved. Some people don't find that until their junior year. Some people don't find that till like the first semester of their senior year. And so it's okay if you're even later along in your journey and still trying to find that group of people that you really fit in with. Aside from that, I mean, the blessing and a little bit of the curse of Virginia Tech is we have one of the highest utilization rates of our services in terms of like Cook counseling in the entire country. Student utilization rate of counseling services tend to be around 10% at most colleges. At Virginia Tech, we hover around like 16 to 18%. So way above the average. When we've done, well, when the university has done climate surveys, between 99 and 100% of students report knowing about the counseling services and where they are. So we know that students know about us. They tend to utilize us pretty well. I think what I would recommend, especially for parents and for students if they're on the call, is don't wait until you're past the point of being overwhelmed into complete distress to reach out. Please reach out if that's the point that you're at as well. But really where a lot of the work can happen is in that preventative stage, really when you're starting to notice, okay, I am feeling more anxious, I'm feeling more depressed, maybe I need to reach out for services. And then we can get you connected. So I think that those would be my recommendations.
Jonathan, can I add one more thing for rec sports too? Just another way for students to get involved is we have more than 600 student employees. And so from running our facilities to teaching group exercise classes, referees, lifeguards, there are so many opportunities again for them to be involved and meet people. And rec sports, I'm a little biased, but it's a really fun place to work. So instant family and just a great support system. So that also is on our website. And, we've hired for the semester, but it's going to be January before we know it. So get those applications in because we need students.
I would just like to echo that really quick. Rec sports was definitely super influential in how I got involved my freshman year. And that made or break pretty much how I felt involved and at home at Virginia Tech was the intramural department and rec sports in general. And so if you can encourage your students to reach out, we'll be definitely hiring either referees or supervisors or in other departments in January. And that is definitely a must.
All right, so I'm going to end this with the question I always ask people when I do a panel is, what is one thing you want our families to remember or want them to take away at the end of this? And we can go in reverse order.
I need a moment to think of an answer.
And that's okay. It can come back to you.
I think what I would want families to remember is kind of in line with what Kelly was saying. You know your student, your child. If there's students on the call, yourself. Check in with one another and with yourself to know, when is it that I need to reach out? When is it that I need to make some adjustments? I think it's so easy, especially right now in pandemic world, to feel like even coping skills that we've had before, we don't have access to, or they're more difficult to utilize. And I think it can feel a little bit like we have to shut down. And while that is completely understandable, I think just knowing the point at which you need a little extra help and knowing that there are many, many resources across campus that can help with that, you know, whether that's Cook, whether that's Hokie Wellness, whether that is Rec Sports, you know, whether it's the Student Success Center. John, it was the source that involvement advising is through, but even the source has many other resources to get you connected with folks. Yeah, and I would just say also, like, loneliness is to be expected right now. And also, there's so many ways to get you connected to other students, to other people. The library is finding ways to host like game nights. There are resources out there. It's just a matter of finding the one that works for you.
You want me to go?
I stink at the reverse order thing. I don't know.
I'm like, John forgot he was in the middle. Okay, for Rec Sports, we just want, for those of you who don't know, our mission is to help everyone find their Hokie movement, right? Everyone knows that moving makes all aspects of our life more healthy, but we also know that if you don't enjoy the movement that you're getting, you're not going to sustain it, right? So our job is to help students find a fun way to move and stay healthy, both physically and mentally. So with that, I'm going to plug the next program that we have coming up. Next week, we are starting an exercise incentive program just for students. It's called the Hokie Movement Club. And starting next Wednesday, we are going to do 8 weeks of fitness challenges. For example, they're going to be simple. They're not going to be impossible. You don't have to be the most athletic person to win. The first week, we're going to encourage students to work out twice, because research tells us that students that work out 2 or more times a week have higher GPAs and get higher test scores. And so of all the students who complete the challenge, we're going to randomly draw for amazing prizes. We have brand new Hokie Movement shirts that every member that logs in and joins will get. So we're just going to have a lot of incentive to get kids outdoors, to be moving. And we're going to use an app called Strava that sort of will have like a Facebook feed where tech students within that club can see what other tech students are doing. And we did a similar group this summer with employees, and people have met each other. So again, while it's virtual, they're still going to be going outside and exercising and using our facilities, but also meeting people both while they're exercising, but also while they're on that app. So we're really excited to be able to encourage students. There's an unlimited amount of students that can join. So again, I would encourage them and parents to go to the website and look for the Hokie Movement Club and join us.
Jonathan, remind me what the question was again so I can make sure that I...
Absolutely. It was, what is one thing that you want our families to remember at the end of this?
Oh, good. Since I've been here for 30 years, I've seen a lot of things happen in the history of Virginia Tech and a lot of crises and all. And I guess the one thing that I want all our parents to know is, while things aren't perfect, I'm really proud of the way that Virginia Tech and the employees and the students have handled this situation. We are doing way better than a lot of universities, and it's hard to fathom how complex this is. Sometimes when you're on the outside of it, it's easy to point fingers and criticize, well, this isn't perfect or this isn't the way it was. But so I guess what I want families, not just the families here, but all across the board, is knowing from my vision, and I'm generally a call it like it is guy, I think Virginia Tech the employees are really working hard to make this happen and do the best we can given the situation. So thank you to all y'all, the students and parents and faculty that are helping us get through this. So that's what I want to say.
All right, well, families, thank you for joining us this morning. I don't know what time it is, but thank you so much for joining us and hearing what we have to say. And we hope that you will continue to engage with all of the things going on during Family Weekend. And as always, go Hokies.
Thank you for a great session.